Root canal therapy is dangerous, they say. It causes systemic diseases, they say. But is there any truth to these claims? Today, we're unpacking the term holistic dentistry, its marketing strategies, and the science behind root canal therapy right here in the heart of New York City. Holistic dentistry claims to focus on the connection between the mouth and the body. That sounds good, right? But here's the kicker. That's not holistic dentistry. That's just dentistry. At our school, one of the oldest dental schools in the world, our mission statement emphasizes this exact connection. Dentists are and have always been physicians of the mouth. That's nothing new, nor does it need a new label. So why the term holistic? Well, because it's marketing. It's a label that separates some dentists from others, not by philosophy, but by branding. And often it's used to push claims unsupported by science that taps into people's fears and anxieties. In my view, there are only two types of dentistry. The first kind is just dentistry, which is rooted in science, emphasizing the mouth-body connection, patient-centered care, and focusing on ethics. Everything else is what I call dental carpentry. That's dentistry that prioritizes on procedures and profits over patients, focusing on the business side of the profession rather than healthcare. Of course, this dichotomy is not unique to dentistry, but all aspects of healthcare. All dentistry is inherently holistic, and anyone who falls short of it is not practicing dentistry, but dental carpentry. So why are we seeing misinformation flourish under this label? Well, it's because of social media, where shocking claims travel much faster than nuanced truths. In an MIT study, investigators studied 126,000 news stories over an 11-year time period. False stories were 75% more likely to be retweeted and shared than true stories, and false news reached people 7 times faster than the truth. Essentially, fake news is more viral. Another study in 2021 Proceedings of the National Academy of Sciences showed that social media posts spread more readily if they were emotionally charged, demonstrating again that fear-mongering works more efficiently than sharing the truth. Now let's tackle the elephant in the room, root canal therapy. Holistic dentists often claim that it's unsafe because it traps bacteria causing systemic diseases. But here's the scientific truth of the situation. 1. High success rates. Studies show that primary root canals have success rates over 92%. And of the 10% that don't work, 90% can be saved either through revision or surgical procedures like apicoectomy. 2. No link to systemic diseases. Now, research consistently finds no credible evidence connecting root canals to health problems such as cancer or heart disease as a causative agent. Now, keep in mind that correlation is not causation. But to that effect, a study published in JAMA Otolaryngology, Head and Neck Surgery, found that patients with multiple endodontic treatments had a 45% reduced risk of cancer. And this robust finding highlights not just the safety, but probably also the types of people who try to save their teeth, who generally also have healthier lifestyles. 3. Elimination of infection. X-rays post-treatment reveal bone regeneration and healing. The procedure works. Now, all the patient needs to do is a robust follow-up protocol for validation and confirmation of success. The claims often rely on outdated theories, such as the focal infection theory from the early 1900s and Weston Price's benchtop studies of 1925, which is 20 years before even the discovery of lidocaine. Today, modern endodontics using microsurgical techniques and materials has proven these fears to be unfounded. It's one thing to promote wellness, but it's another to distort science for profit. And that's where we must draw the line. Even though all dentistry is holistic by nature, I don't want to generalize against colleagues who, for one reason or another, identify as holistic dentists. Obviously, not all holistic dentists are quacks. The nuance between marketing and scam lies on whether the procedures you bundle are scientifically based and evidence-supported, or it's just the mere opinion of the provider that is based on fear-mongering. Insofar as endodontics is concerned, extracting teeth merely because they've had root canal therapy without regard for their actual apical status is a pure scam. But holistic dentists who engage in a nuanced conversation with their patients about quality care and recognize the high success rate of well-done root canals and avoid promoting unnecessary tools or products while genuinely aiming to improve patient health are still within the standards of care. It's essential to acknowledge that endodontics has evolved significantly, particularly with the development of microsurgical techniques and materials. Dentists who understand that all medical procedures carry inherent risk and plan for contingency while providing robust follow-up schedules to verify successful outcomes are honest actors in providing care. With proper follow-up and verification, the concerns associated with any dental procedure can be mitigated. Subscribe for more content like this, and until next video, I'm Nasseh, and let's save some teeth.